I received this question in the comments from Jonathan Horse and decided to make a video response as it's too long for a written reply, and I thought more people would find the answer valuable. Why do a Lachman test and a pivot shift test? It's a great question, and it gets to the heart of how knee injury assessment actually works. If a Lachman is already positive and the mechanism fits an ACL injury, why do more tests? Because diagnosis isn't binary, it's about confirmation, context, and consequence. You must remember what the ACL actually does. Its two main roles are to provide stability to the knee, stopping the tibia sliding forward relative to the femur, which we test for with anterior draw and the Lachman test, and also in controlling rotation, which we test for with the pivot shift test. The ACL also has a huge role in proprioception or joint awareness, which isn't talked about enough, but otherwise how can 3 or 4 centimeters of tissue have such an impact on the entire system when torn? Anyway, back to the examination. During examining a knee, a positive Lachman test tells me there's anterior to posterior laxity and an ACL injury is likely, as it's not doing its primary role in controlling the tibia moving under the femur, but it doesn't tell me how functionally unstable the knee is, whether there's rotational instability, or whether other structures are involved, and that's why additional tests still matter. And so the pivot shift is not redundant. It assesses for the other main function of the ACL, the dynamic rotational instability, what patients actually feel when they twist, cut, or change direction. 2 patients can have the same MRI, the same Lachman, yet completely different symptoms and functional instability, and that difference really matters. I'll explain why in the next video.